Good morning. My name is Audrey Gordon. I'm the Minister of Health. I would like to thank all of you for joining us today. Joining me here today is Premier Heather Stefanson, Mike Nader, the CEO of WRHA, Nicole Aminot, interim CEO of St. Boniface Hospital, Karen Fowler, CEO, St. Boniface Foundation, Dr. Paul Ratana, Emergency Physician, Medical Director of St. Boniface Emergency. I would like to start by acknowledging we're gathered on Treaty 1 territory and that Manitoba is located on the treaty territories and ancestral lands of the Anishinaabe, Anishinish-Inukuwak, Dakota Oyate, Deno-Sulane, and the Nehi-Towak. We acknowledge Manitoba is located on the homeland of the Red River Métis. We acknowledge Northern Manitoba includes lands that were and are the ancestral lands of the Inuit. We respect the spirit and intent of treaties and treaty making, and we remain committed to working in partnership with First Nations, Inuit, and Métis people in the spirit of truth, reconciliation, and collaboration. I'm deeply honoured to be here today at the cornerstone of Manitoba's health system, St. Boniface Hospital, which is also the home of cardiac sciences in Manitoba. I was sharing with some of the individuals in the audience that I met when I arrived here that I worked in this building. It's so great to be back here today. Since it was established in 1871, St. Boniface Hospital has provided global caliber medical care with compassion and innovation. The Manitoba government is grateful to the hospital's medical and support staff, research personnel, administration and volunteers for their ongoing dedication to patients and clients and their families, particularly through the COVID-19 pandemic. People who come to our emergency departments do so on what could be one of the most difficult days of their lives. Here at St. Boniface, there are tens of thousands of visits like this every year, and we know this is expected to grow over time. To speak more about how we will meet those needs here at the St. Boniface in the years ahead, I'm pleased to introduce Premier Heather Stefanson.
Thank you very much, Minister. And I was just saying before I get started, I think the last time I was here, so when I was Minister of Health, we were meeting virtually at that time, so I didn't get a chance to be here at that time. But the last time I was here was when I was having my son and he was born. So it's been a little bit, a little while, but wonderful to be back here. Good morning, everyone, and I'd like to welcome and thank all of our partners and leaders in the health system, members of the WRHA, of Shared Health, of the St. Boniface Hospital, and of course of the St. Boniface Hospital Foundation, the staff and volunteers for joining us here today. 2 weeks ago, our government announced Budget 2022, Recover Together. It is a budget built for Manitobans, informed by Manitobans. It provides strategic and significant investments in key priority areas that matter most to Manitobans. Manitobans have told us that health care is the #1 priority, and we are listening to them, and we are acting on that. St. Boniface Hospital is a cornerstone of Manitoba's health system. It supports hundreds of patients and their families each and every day, many at a time of urgent need. And so it gives me great pleasure to announce today that the expansion and modernization of the St. Boniface Emergency Department is officially underway. This $141 million multi-year capital project will see the current emergency department triple in size, improving patient care and reducing wait times for Manitobans. The new emergency department will feature over 86,000 square feet of additional newly constructed space and over 18,000 square feet of renovated existing space. The new emergency department's state-of-the-art design was strategically developed to reduce wait times and the length of stay in the emergency department. to improve patient and staff experiences, and maximize functionality and flexibility with expanded space for increased patient numbers. The inclusive barrier-free facility will have numerous features that improve patient care, including an expanded wait room and triage area, an expanded central resuscitation area, a dedicated diagnostic imaging suite with a new CT scanner and X-ray machines, private exam rooms in treatment areas, a dedicated mental health treatment area, a dedicated ambulance entrance and parking bay for 10 ambulances, a new covered south entrance to reduce congestion, an improved south parking lot, and a public use outdoor garden space. Wow, this is going to be amazing. Our government's #1 priority is to strengthen the health care for all Manitobans. A new expanded and modern emergency department at St. Boniface Hospital will advance our shared goal to increase system-wide capacity and improve patient care across the province. St. Boniface Hospital is an essential part of the healthcare system, and today's announcement will strengthen its critical role in meeting the needs of the communities that it serves and the people that work to care for those in need. I look forward to coming back here in just a few years when the doors open to this state-of-the-art facility that will most certainly improve the lives of Manitobans for generations to come. Thank you so much for allowing me to be a part of this today. Thank you and merci. Minister, back to you.
Thank you, Premier, and what an amazing announcement today for not just the St. Boniface community, but for all of Manitobans. I'd like to now introduce Mike Nader, CEO of Winnipeg Regional Health Authority.
Thank you, Minister Gordon. Premier, it's nice to see you. It's a pleasure to be here with all of you today. As many of you know, the Manitoba healthcare system has been undergoing one of the largest transformations in a generation, focused on operating more effectively, improving access to services, and ensuring that we meet the needs of our community. This transformation process includes the long overdue modernization of the St. Boniface Hospital Emergency Room Department. As the largest tertiary hospital in the WRHA and the Cardiac Centre for Manitoba, St. Boniface is critically important, not just for the delivery of emergency medicine services, but also for the regional health system as a whole. The current emergency room was built to meet the needs of generations past. The new ED will meet the future needs of future generations. The improvements resulting from this project will have enormous impact on the system and for patients in our community. The St. Boniface Emergency Room redevelopment is an important step for improving health services in the Winnipeg region and across the province. We are so excited to be providing a more welcoming, culturally safe and healing environment for patients and families who need emergency services. We're equally as excited to create an environment that can parallel the extraordinary services that the women and men in the emergency room provide every day. Without them, there would not be an emergency department, and we are grateful for their ongoing dedication and commitment to serving our community. Thank you.
Thank you, Mike. And next, please help me to welcome Nicole Aminot, who's the interim CEO at St. Boniface Hospital.
Thank you, Minister Gordon. Bonjour, I'm Nicole Aminot, the Interim President and CEO here at St. Boniface Hospital. Our hospital celebrated a significant milestone last year, marking 150 years of offering medical services to the community here on the banks of the Red River. St. Boniface was the first of its kind in this province and remains today a major acute tertiary care centre, serving as one of the most important healthcare facilities in Winnipeg and in all of Manitoba, including our role as the province's centre of excellence for specialty cardiac care. Nous sommes heureux de célébrer nos 150 années dans le domaine des soins médicaux ici au Manitoba. Nous sommes fiers de notre passé, mais aujourd'hui nous nous tournons vers l'avenir. Le personnel de notre service d'urgence fait un travail acharné et démontre des habiletés incroyables quotidiennement, tout en répondant aux besoins des patients. Ils réussissent cette énorme tâche malgré un environnement vieillissant. Nous avons donc hâte de pouvoir offrir, grâce à ce projet, un nouvel environnement de travail réménagé, amélioré et agrandi. Le séjour du patient sera amélioré ainsi que des espaces dédiés aux familles. Les processus cliniques seront plus efficaces. En plus, il y aura de nouveaux espaces tranquilles et reposants pour notre personnel. Les patients, leurs familles, le personnel ont tous droit à un nouveau milieu combinant une philosophie de soins et des installations d'avant-garde spécialement adaptées pour les soins d'urgence. Nous pouvons être fiers ici à l'hôpital Saint-Boniface de voir ce rêve devenir réalité. Je tiens à remercier nos partenaires de leur participation active et de leur soutien envers ce projet. La cérémonie d'aujourd'hui marque le début des prochaines 150 années et des travaux d'un projet dont la réalisation aura un impact des plus positifs sur nos patients, leurs familles, nos employés et la communauté. Merci.
Thank you, Nicole. Next, please welcome Karen Fowler, CEO of the St. Boniface Foundation.
Thank you, Minister Gordon. Premier Stephenson and distinguished guests, on behalf of St. Boniface Hospital Foundation and our Board of Directors, it is my absolute pleasure to be here with you today and to share in this exciting news. Compassionate care is a hallmark of St. Boniface Hospital. At the Foundation, we are fortunate to hear every day from Manitobans who are eager to share their positive hospital experiences and outcomes. Many of these stories involve emergency care, and the details are often tender and touching. The prevailing sentiment, though, is gratitude. Patients and family members come to us because they are inspired by the compassionate care that they receive. I'd like to share just a few quick examples of the types of notes we receive from these grateful patients. The staff at St. Boniface Hospital knew they could make the experience better for people like us at a time when we didn't know what was going to happen next. All the staff treated me like I was the most important person alive. They helped me through the worst time of my life. The support and encouragement I received from the caregivers carried me through my ordeal and gave me the strength to fight for my life. Just like our healthcare providers persevere to bring the spirit of compassion to the bedside, our donors and supporters have opened their hearts for the health and well-being of Manitobans. They are steadfast in their dedication, and what a difference they have made for the hospital, its staff, and its patients throughout the Foundation's 50-year history. Time and again, our community of donors have rallied in support of life-changing advancements for patients here at the hospital. And so I am confident that together with St. Boniface Hospital Foundation, our donors will play a vital role in this extraordinary opportunity to elevate the standard of emergency care at St. B. Today, I invite our entire community to join the Foundation in making a $10 million investment in this project to expand and renovate this essential space for patient care. Together with the Province of Manitoba, we will build the emergency department we need to continue providing the best possible patient care with an unwavering spirit of compassion. Thank you.
Thank you, Karen, and I thank the Foundation for their generous contribution to this very important emergency department redevelopment. Next, a few words from Dr. Paul Ratana, an emergency physician and medical director of St. Boniface Emergency Department.
Thank you, Minister Gordon. Premier Stephenson and gathered guests, thank you. I'm the Medical Director for St. Boniface Emergency Department, and I'm a practicing emergency physician here at this hospital. I have worked here for more than a decade and have served as the Medical Director since 2018. Through this experience, I can honestly say that the doctors, nurses, and other allied healthcare professionals at St. Boniface Hospital do amazing work, and they are among the most inspiring and dedicated professionals that I have had the privilege to serve with. They are excited about this opportunity that the facility renewal brings. Many people may not realize that there are clinical procedures and life-saving interventions done at St. Boniface Hospital that are not available elsewhere in Manitoba. The emergency department is the gateway for these patients, and many of these treatments are initiated in the ED. Among those procedures are those offered by the Cardiac Sciences program and include rescue cardiopulmonary bypass, where critically ill patients are stabilized using mechanically aided circulation. And there are also innovations in advanced cardiac imaging that our emergency providers are implementing, like the use of transesophageal echocardiography during cardiac arrest. And what this means is that we're able to continuously see the heart during resuscitations through the esophagus. As the cardiac center of excellence for the province of Manitoba, we are constantly looking to incorporate medical advancements in emergency medicine to our patients. The opportunity to build clinical enhancements into the design and incorporate elements that improve patient care are among the most exciting parts of this project. As mentioned, the new emergency department will have CT, ultrasound, X-ray, and lab work integrated directly into the ED footprint. Currently, they are located elsewhere in the hospital, and this contributes to inefficiencies in patient care. The emergency department at St. Boniface is the primary destination for all non-traumatic cardiac arrests for the city of Winnipeg. An important component of this project will be the enhancement of resuscitation capacity in our ED. For those patients and families who spend their last moments in our emergency, an end-of-life room will be incorporated to support those difficult but important moments for families. One of our existing resuscitation rooms will be converted to a simulation lab, and ongoing education for our staff will occur there. There will be a dedicated mental health pod, which will add 6 rooms and have integrated security features and mental health supports. And finally, there will be pandemic-informed infection control considerations, like isolation rooms and enhanced HVAC. We've been able to incorporate many of these elements thanks to frontline clinical involvement in the design process. I have been a part of that process, as have many of my colleagues at the hospital. We are all looking forward to the opportunity to practice in a brand new facility that will help us offer even better emergency care to our patients. Thank you.
Thank you, Dr. Ratana, and thank you all for being here today. Our government remains fundamentally committed to providing safe, high-quality health care for Manitobans that meets their current and their future needs. And this $141 million investment recognizes the critical role St. Boniface plays in providing emergency care, helping Manitobans when they need it most, and more broadly recognizes its place in our healthcare system in the years to come. We'll now take some questions and then take a few photos to mark the official start of the construction of this incredible project. A photo will be taken inside here, and then we will be going outside on the site to take a shovel ground turning photo. So save your exposures for that.
Yes, Bartley.
Hi. Given that this was announced in the 2019 election and envisioned earlier in the wait times report, why is it taking so long to get?
Well, it's not that things haven't already started. I was just talking to the folks from PCL who are here today, the builders, and they have started already. So, you know, of course, COVID came into play, and some things were delayed, and supply chain things, and so on. And so here we are today. I think the exciting part about this is that it is being announced, it is moving forward. So, and I think it's going to be great, not only those for people in the city of Winnipeg, but for all Manitobans.
Recommended this actually happened before consolidating and closing ER. So that happened a number of years ago now, pre-COVID, long before COVID. Why not do this first or immediately after if you're going to be closing and consolidating ERs?
Well, I think this is all part of the clinical preventative services plan. This is moving forward, you know, in the fashion that it is. And I think the important thing is that it is moving forward. And it will be able to provide those services and continue to provide those services for Manitobans and provide more services here locally.
It's going to be a number of years before this is done. So what's being done immediately to address the wait times? I know we heard from the minister yesterday who said she insisted that it be fixed. Well, it's nice to insist, but what's going on to make sure it gets fixed?
I'll let the minister answer that more clearly, but obviously this will be done by 2025 is what my understanding is. This will be a process that takes place over the course of the next few years. If we're looking at more specifics when it comes to the other part of your question, I'll ask the minister to come forward and answer that.
And thank you for the question. I'm going to loop in CEO Mike Nader because he has been working very closely on the ground at the emergency departments in his region, talking with staff and developing plans. So I'll let him expand on those. But in terms of what our government is doing, so we've talked several times about the need to ensure staff are available in units and in program areas as we seek to expand and innovate our system. And that is why our government has invested $19.5 million to add 259 nurse training seats this year. And this will be done at 5 post-secondary institutions, leading to our expansion of 400 seats. I shared many times in the chamber that I was so pleased to join the Faculty of Nursing last October to welcome 115 new nurses to our system. And we're going to continue to encourage individuals to take the critical care nurse training program. We have our undergraduate nurse educators, 3rd and 4th year students joining our system. And we continue to work with the College of Registered Nurses of Manitoba to ensure that our internationally educated nurses also have the opportunity in quick fashion to join our healthcare system. So a lot more announcements will be coming in the days and months ahead, but our government remains committed in Budget 2022 to add in $7.2 billion to the system. And that is going to allow for some very innovative initiatives to come forward. And I can't share all of them with you, but very many exciting announcements to come. I'm going to turn it over to Mike to talk specifically about initiatives underway to address the wait times issue.
Thank you, Minister. We talked a little bit about this yesterday when we had the conversation. So there are a number of activities that are currently happening with regards to a variety of work bundles. We did some work with our local ambulance to ensure that we were redirecting patients to the sites that had available capacity to be able to meet the needs of the community safely. So our paramedics are actively assessing patients throughout Winnipeg and determining which site they could direct them to receive the care. That's a big bundle of work. I had a great meeting with the emergency physicians here at St. Boniface Hospital, where we talked about a number of opportunities to transition patients who require inpatient care up to the inpatient units. And we have quite a bit of work still to do in terms of transitioning patients who are up on our inpatient units and transitioning them back into the community. And our home care teams are working actively on opportunities to move that forward. So we don't have the robust project plan right now, but that is being developed with our care teams with collaboration from our clinicians and our leadership.
What about those long backs? That's been one of the biggest issues for shared health. I know it's talked about, and WHO has talked about getting people out of the ERs up to the different areas that they need to be, and that's why our ERs are sitting so full.
Yeah.
What can we do right away to address that?
Yeah, so one of the biggest opportunities, I believe, is the length of stay within our inpatient units. And so that is creating the opportunities for patients who no longer require acute care services to transition into the community. And so we have a Home First program that enables people to transition to the community and be supported in the community with home care. Obviously, over the last little while, we've experienced some disruption in that, and that's created a backlog with patients who could potentially go home, but we have not been able to pull them out. So when we have a snowstorm, and I'm new to Manitoba, but I saw on Twitter somebody saying, hey, this is Winnipeg, what you should expect. But I can tell you, when we have a snowstorm like that, it backs us up for many days, and our teams have to put extraordinary efforts to address that. So that's what we're working on.
Mr. Nader, you're new to Manitoba, but you're not new to epidemiology. Obviously, the province has eliminated all of its pandemic restrictions. I know you were asked yesterday, but we're all wearing masks here right now. It wouldn't be the silver bullet. It would not help if everybody wore masks right now when we have such a highly transmissible sub-variant.
Well, Bartley, I think we talked about this yesterday. I think the challenges that we face as a system are not going to be singularly fixed by a public health order. The issues and the challenges that we're experiencing within the health system are multifaceted, and there are going to be a number of issues that need to be addressed.
I asked, would it not help as a measure? I didn't ask, I just said it would be a silver bullet. I know it's not a singular fix.
Yeah.
Would it not assist, in your opinion?
Well, I think people are doing what they feel they need to do in terms of protecting themselves. I'd encourage people to continue to do that. I encourage people to get their vaccinations and their booster shots to enable that to move forward. But again, the public health orders are not going to singularly fix this problem. Thank you.
A week ago, you referred to COVID hospitalizations as incidental. Dr. Roustan said similar things. The health minister has said similar things. We heard yesterday from Mr. Nader that the large number of COVID patients is actually causing workflow disruptions here. Clearly, all the infected people who require infection control, PPE, they take longer to move up there. There is an issue. Do you stand by your position that there is nothing the province should do from a public health perspective?
Well, again, we take, and Bartley, I've answered this before, we take advice from public health when it comes to this. And again, I would, like Mr. Nader has said as well, I think we should encourage as many Manitobans to get vaccinated, get their boosters. That is what's keeping people out of hospital and out of the ICU. We've seen that. And so there's some things there that, you know, obviously we want to encourage Manitobans to continue to do.
But if you're encouraging people to get vaccinated, where's your public education campaign on booster shots? Where's the ad campaign? Where is a replacement for Dr. Reimer of speaking about the importance? Where is that?
Well, I know the minister has been out diligently, and we've been working with, and all of my colleagues have been out diligently talking about the importance of getting boosters, and we'll continue to send that message out there.
When it comes more to the wait time report came out a number of years ago. Is anything else being looked at that right now to start implementing to put up with these wait times?
The wait time report, is that?
So thank you for the question. Since the wait times report has been implemented. We've added, I think, 1,000 hips and knees. We've looked at telehealth services. As you know, during the pandemic, individuals were able to see their physicians virtually. So we've looked at emergency department protocols to move the patient flow within the system. And so a lot has been done, and we recognize as a government that more needs to be done. And that's why, as I mentioned yesterday in my scrum with the media, that as the issues have been amplified as a result of the pandemic, we've also amplified and strengthened our commitment to Manitobans in terms of what our government will do to address these issues. They go back a long period of time, and but the commitment by this government is very, very strong, and we will continue to work with our partners, such as the CEO of WRHA and all the healthcare professionals across the province, because the ideas come from many different sectors of this system. So anyone has a good idea, I want to hear about it.
What wait time would be acceptable? Seeing some at 9.5 hours right now. What is acceptable for people to be waiting in an ideal, obviously not zero, that's not ideal.
Yeah.
What is acceptable?
So I think what we need to do is look at national standards. I know CIHI puts out reports on a regular basis for the various sectors of our health system and look at what makes sense. And we also have to look at what's happening in the environment as well. Like, we've just come through, and not fully through yet, a 2-year pandemic, over a 2-year pandemic, and so what are the accurate or reasonable wait times, given that we are still addressing some of the issues related to the pandemic? We still have patient flow issues, as CEO Nader mentioned, and so it's very difficult at this point to say this is what the wait time should be, because we're looking at all the factors that are contributing to the delays in our system.
Third doses of the vaccine are preventing hospitalizations, Minister. Why isn't the province doing more to advertise people getting their third doses of the vaccine? We've seen lots of advertisements for the budget 2022. Where are the advertisements to tell people to get out and get their third dose? Why aren't we seeing more of an effort from the province to
So I disagree that the province isn't doing more. We're doing absolutely a lot to get that message out. I myself was publicly vaccinated for my third dose. We have social media campaigns running. I don't know if you've taken a look lately at some of the benches in your area as you're driving throughout your community, but we still have our COVID vaccine benches out. We continue in the health system. I know I mentioned yesterday that I saw my physician last week, and he was going through the electronic medical record system just to make sure that I had been triple dosed in terms of receiving my vaccine. So our physicians are doing that, our pharmacists are doing the same, and it is a whole of the health system approach to ensuring that Manitobans know about the importance of this. And we will continue to make those efforts to ensure Manitobans know how important it is to get vaccinated. We're not out of the woods yet, and vaccination is our best defense against COVID-19. Thank you. Yeah, we've still got them on our bus benches. Yeah.